And the next speaker will be Dr. Mahmood Nadeem, a general practitioner, very proud being born in Baghdad, Iraq, high school at Baghdad College, 1998. Finished his medicine study at Al-Nahrain College in 2004, worked in medical city in Baghdad between 2005 and 2012, master degree in physiology and urodynamic studies in 2011, general practitioner in Qatar for 3 years, 2012 to 2015. In 2015, moved to Australia, and diploma in child health from University of Sydney, 2017, fellowship in Royal Australian College of General Practitioner in 2021, and the list will keep going. He has a strong interest in general medicine, chronic disease management, weight loss treatment, and family health care. Please welcome Dr. Mahmood Nadeem.
Thank you, Dr. Ali, and hi, everyone. Well, wait, okay. All right, so regarding weight and weight gain and obesity, probably it's working as a GP, especially in Australia, obesity represents half of our work. It's related to too many things, like the patients will be either complaining from pain, depression, sleep apnea, heart conditions, high blood pressure. So we have many things, but most of them weight related. So the benefits, let's say here, of weight loss, improved heart health, and the heart health, better blood sugar, reduction of joint pain, improve urinary incontinence, increase energy level, enhance sleep apnea, and enhance sleep quality, and reduce risk of several cancers. But the issue is, most patients don't like to talk about it. So our job here as a GP, as GPs here in Australia, we have to initiate, although it's a bit sensitive thing, but my advice to everyone, be proactive, initiate that, open the subject with your patients, and you will get the benefit. Once you start talking about it, but in a sensitive way, they will be open, they will talk. And you will find, like, there are many people who are struggling in life because of obesity. Now, let me talk briefly about the medications right now, because we have some points about these medications. As Dr. Majid said, 6 of them are approved in Australia. So what's the discussion? The most important thing when you open this subject is you have to discuss the medications. What are the... First, you have to understand what's the situation here. Whether if the patient prefers, like, if there is any preference for he or she prefers injectables or oral. That's one of the things. The other thing, be realistic, and when we are realistic, we have to talk about the cost. Because some medications like Mounjaro gonna cost the patient with the maintenance of high dose $9,000 a year. While other ones are like Duramine, they are much cheaper. Again, effectiveness against cost. The second thing we have to talk about the contraindication. Like Duramine is contraindicated in patients with heart conditions. It has serious side effects. Patients cannot continue using it. The other thing is the what's the target? Are we talking about 5 to 10 kilos or more than 20 kilos? So all these things has to be discussed properly with the patient. So education is very important. Also the duration of treatment. We have to be very realistic with the patient. Oh, sorry. Oh, sorry. Yeah. Thank you. شوية طويل يعني. So that's one of the things also. Of course, it depends on the BMI. If the BMI is more than 40, it's a different story than the BMI is more than 30. Now, the first one is the Duramine. It's one of the oldest medication. The problem with it is the side effects and the duration of treatment. We can't go more than 3 to 6 months. That's it. It's cheap. Price starts between $80 to $150 a month, something like that. The good thing is oral medication. It can initiate. So if the patient is reluctant, you can start with him oral medicine. It's once a day. It's the first step for the patient, could be for weight loss journey. And you also involve dietitian, probably exercise also. So with this, it helps. But the problem, we can't keep using that. Usually we start with 15 milligram and go up. Very important education. Many patients will say, you see the patient next week. My advice to see the patient next week, because many of them will have palpitation, will have insomnia, will have, feeling anxious, and they couldn't. Many patients can't tolerate it. That's one of the things. Again, check blood pressure, ask about smoking, ask about mental health. These are very specific things regarding when you prescribe Duramine. Now, the other one is the Contrave. Contrave is an oral medication. Probably it's not very popular because it has moderate effectiveness, but the price is high. It's more than $250 for the box. We have to educate the patient. It's good because it helps with improving mental health. So it can be used for depression. Like one of the bupropion can be used for, because it's an antidepressant, while naltrexone can be used for alcohol overuse treatment. So this medicine is a combination of the two medication. So any patient who are going to use that, there is a chance that there is some benefit on mental health. The issue is with the use, you start with 1 tablet a day for the first week, then 1 tablet morning, 1 tablet at night, then 2 tablets in the morning, 2 tablets, 1 tablet at night, then 2 by 2. Main 2 side effects of this medication is constipation. The main 2 side effects are constipation and headache. Most of the patients who has stopped taking this medication because of the headache. Practically speaking, as a GP, I try to give them like Panadol, because especially in the first 2 weeks, then body can adjust. But if they can't tolerate it, then that's it. So these are the 2 main ones. There is also the Xenical. Xenical effectiveness is not the best. The side effects could be terrible sometimes, especially fecal incontinence. So you have to educate the patient very well about this, because sometimes it will be very embarrassing. The dose is usually 3 capsules a day, but realistically, you have to start with 1 capsule a day and see the patient and educate them that the side effects won't happen the same day. It may happen next day or the day after. So they have to be very careful, and they have to be mindful about that. Sometimes gas incontinence can be very distressing. Other side effects including fat-soluble vitamins deficiency, specifically vitamin D. The cost is nearly $100 for the big box of 84 capsules. So these are the main things regarding the Xenical. Now, let's start with the injectable ones, which are the game changers. The most important and most popular one is the Mounjaro one, and the most effective, but again, the most expensive one. Side effects: nausea, vomiting, constipation, diarrhea, but you have to educate the patient very well regarding pancreatitis. It's rare, it's less than 1%, but when it happens, it can be very serious. All right. The good thing about Mounjaro is don't be afraid if the patient is going to start having the side effects. You have to try to adjust the dose and no need to increase it. That's one of the things. Same thing with the Wegovy. The dose is adjustable. Wegovy is a cheaper option, so probably it's nice to start with Wegovy, and if the patient if there is no good response, then we can upgrade to Mounjaro because it's nearly half of the price. Again, the dose is adjustable, so if the patient has side effects, you can try to reduce it. We have the flexibility. It's 0.25 or 0.5, we can reduce it a bit. So sometimes we use 0.4 or 0.3, but again, according to the discretion of the doctor. Saxenda, in my experience right now, I think no one of my patients on Saxenda. It's an old medication right now, and the cost is high. It's a daily injection, not being used anymore. So these are the main points. The key points here, depending on the presentation. If the patient has obesity with depression, probably think of Contrave. If there is constipation, you can add Xenical, it helps. If there is diabetes, of course, Mounjaro or Wegovy. If the cost is not an issue, Mounjaro. Always follow up 1 to 2 weeks, then monthly. Lipase check is not mandatory, but it's advisable. Again, education is the critical and most important thing. So always education, 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 and be realistic with the patient. It's a medication case by case. Sometimes it works, sometimes it doesn't. So be realistic. There is no guarantee that the patient is going to lose weight. Some of them used it and they said, we have used just water. Okay. So that's the main thing. Thank you.